Inside St. Vincent's Medical Center, neurogastroenterologist Dr. Amir Masoud with Hartford HealthCare Digestive Health Institute offers an innovative reflux treatment called transoral incisionless fundoplication, or TIF, to improve symptoms such as reflux and regurgitation.
This is the patient's esophagus and this is her stomach. And while you shouldn't see this ball-like structure, it should just be a straight shot into the stomach.
But for one patient, a rare diagnosis, a woman's stomach pushed into the hollow tract of the esophagus, an unlikely case among humans, something Dr. Masoud says has only been reported in animals.
I was losing weight.
2 frustrating years, and now Daisy Gonzalez knows why. Dr. Masoud used TIF to solve her perplexing case.
I have been struggling with reflux for a couple of years that progressively was getting worse and not responding to medication. I'd gone to different gastroenterologists who couldn't really figure out what was going on.
But there's more to Daisy's eye-opening story.
She is actually quite complex because she has an underlying condition called scleroderma, which is a connective tissue disorder. And because it's dilated, that's why the stomach puckered up into it. And because of that, she has the hiatal hernia as well, which means that some of her stomach is shifted up into her chest.
Treatment included TIF, the procedure Dr. Masoud perfected.
What we ended up doing was repairing the hernia, so resetting the stomach, and then using this new innovative reflux procedure called TIF. We basically went in and recreated a normal structure so that it wouldn't flip up into the esophagus anymore, and that's what you can see here.
We developed a great working relationship, and there was a lot of trust within both parties. It is amazing. I'm able to eat everything.
Jocelyn Mamenta. For more information, visit hartfordhealthcare.org/digestive.